Hello, Assalamu alaikum. It's me, Dr. Muhammad Naseem Shirzad, and today I'm just going to quickly review what I have written in this cardiovascular system chapter and how to solve the BCQs and how should to be your approach. So, this cardiovascular system chapter is covering just like in a modular system, it's covering your anatomy, it's covering the physiology, it's covering the pathology, it's covering the pharmacology. And I would suggest that there is some medication that I have given in pharma chapter, better to review from there so to cover it as a whole. So I just want to highlight the things just on this single page, like how to solve the BCQs, how the FCPS Part 1 exam question they are asking, what's their methodology, how they can confuse, how to make your concept. For example, I have written the anatomy of the heart. Like it's there are two types of layer of the heart. One is these are the proper layer of the heart, and the other is the pericardium. Pericardium, everywhere in the body, the precious organ is covered by some fluid, and that fluid is actually providing a cohesion effect, and that's protect its proper tissue. Like for testicular, we have that's the space where the fluid is present outside of the testy. Same visceral and layer is present is also there, and when it's huge, the amount is becoming increasing, we call it hydrocele. So same layer is present in the lung, same present in the heart. So number first, the layers which is just uh, one by one inside the heart, and that is the epicardium, that is the myocardium, and that is the endocardium, and that's actually from outside to inside. Now, how the CPSP or FCPS Part 1 exam question methodology. So, number first, it's simply written that it is the outer visceral layer. That's well and good. The second layer, that's actually a MCQ, that it is supplied by the epicardial coronary artery. The second is that this epicardium, which is also MCQs, is actually the epicardium is outer layer, and this outer layer is actually the visceral layer of that pericardium, like which I have written even here, that this layer is the of the serous pericardium is called. So this is MCQ. That's why I have highlighted. So the question which just on this epicardium and CBSP question, that is applied by the coronary artery. This is actually the visceral layer of the pericardium. Now coming toward the myocardium. Myocardium means myo means muscles. So this is actually the layer where there is a present the cardiac muscle. But what important in this? The important is that the SA node is located in the myocardium of the right atrium, just deep to the epicardium. Now they just changing the word and making confuse you, because if they ask that SA node is located in which of the following, and they give you the option myocardium, subepicardium, so you need to select the subepicardium instead of myocardium, because this the word which I have written just deep to the epicardium, just deep to the epicardium means subepicardium. So if they give you the option of myocardium and subepicardium, so your answer should be subepicardium, not myocardium. And they have asked this question and they can confuse. That's why you need to understand the thing exactly what's going on. The second is the endocardium. So it is the inner layer, and again same like the layer which was just out inside the epicardium, that was subepicardium. So here too, in the one which is below the endocardium, that is called subendocardium. But the good thing that this layer is actually containing the whole conduction system of the heart, and there is a question on that. Number second, the subendocardial region. Number first important thing, that the conductive system of the heart is located in the endocardium. The second, which they have twisted, and the reason that this part is actually the subendocardial region, this is the most vulnerable area for ischemia, and this is the most common site of MI. Why? Because this part receiving almost no blood supply during systole. So this is again MCQ. I just want to compel you all on your thought process. I mean, it's not very simple just to go through the things. Number second is the pericardium, and the pericardium is, these are the layer which are just outside the um, proper layer of the heart, and these are two layer, one is fibrous and the other is the serous, and the space between them is called the pericardial cavity, right? So for parietal layer and visceral layer, what's its importance? As I have mentioned, just for to remember it, because you need to use such tactics to understand, to learn, to practice, to discuss. So parietal means like you learn many things with it. Number first, that the parietal layer is supplied by the phrenic nerves, which run in close association with pericardiophrenic vessels. Two MCQs. One, that it is supplied by the phrenic. The second, they are asking in a question that it is usually accompanied by pericardiophrenic vessels. So in many part of the body, they are asking question like this, that the great saphenous vein is accompanied by this. So this is important. Now along with this, you can also learn that it is a sensitive area, pain sensitive area. For this reason, the pain related to the pericardial problem may be referred to the supraclavicular region of the shoulder. That's why in MI patient we are asking in a history, or if they're giving a history of the shoulder pain, so we take it serious because of this embryological, because of this neurological, this nerve supply. So it's again important. Number second is the visceral layer, and for V means vagus nerve, so it means it is supplied by the vagus nerves. And again, the visceral layer of the serous pericardium is also called epicardium, which is I have already mentioned. Number second, if they gave you that the visceral layer is supplied by the cardiac plexus or visceral layer, so you need to select the vagus, not the cardiac plexus. The second is the pericardial cavity, and it's a, already we know that whenever these cavity present, these are actually the potential spaces like in lung, like in testes. So all these cavities are actually the potential spaces, and between parietal and visceral layer is also called epicardium. So you need to understand it. Number second, there is a topic in chapter 31 which is actually I have written on pericardial sinus. Better to review that as 2 or 3 questions from that part of anatomy.